The Hamas-run health ministry in Gaza says at least 70 people have been killed by Israeli shelling and airstrikes in eastern areas of Khan Yunis. Medics say more than 200 people have been injured in the Israeli strikes and that hospitals in the area are overwhelmed by casualties. Meanwhile, the World Health Organization says the number of people needing to be evacuated from Gaza for medical care has risen to around 14,000 and that it is extremely worried about the possibility of a polio outbreak. Thousands of Palestinians have fled Khan Yunis, including many who were in an area previously designated as a humanitarian zone. The Israeli army says the evacuation order is in response to rocket fire. Separately, a meeting between Israel's Prime Minister Benjamin Netanyahu and US President Joe Biden, which was due to take place in Washington later today, has been delayed until Thursday. I spoke to our correspondent in Jerusalem, Barbara Plett-Usher, who told me more about the situation in Khan Yunis.
That military operation is continuing. The Israelis say they have conducted more airstrikes and they've also destroyed weapons stores as well as tunnels. They're going after Hamas militants, they say, in the eastern districts of Khan Yunis. Now, they thought they had cleared this area earlier in the year. There was a sweeping operation in the city of Khan Yunis, and then they pulled out in April. But then they said that there had been increased rocket fire from this particular area, that Hamas was regrouping, so they moved in again. But those evacuation orders were then given to the people living there. So around 400,000 people were living in this area, many of them having been displaced previously. And as you mentioned, this was part of this area had been designated a humanitarian zone. So yesterday we had people fleeing with very little notice, just picking up what they could carry, and some of them running out, but not fast enough, because you were saying that the casualty figures there, many were killed and injured, and now looking for another place to stay. They can go to the other designated humanitarian zone, but that is quite crowded with other people. There aren't that many services. And as a UN official said, the front line keeps suffocating them. It keeps moving, and people are constantly asking, where can we go now? Where can we go now? There's no place safe. So this has been, again, another mass displacement in Gaza.
And Barbara, let's talk about Benjamin Netanyahu's trip to Washington. As he was leaving Israel, there were protests, weren't there? People saying he should be staying and working on a deal to free Israeli hostages. But he is in Washington. What are people saying there about their expectations for this meeting with President Biden? And of course, he's going to be meeting Kamala Harris as well.
Well, he's gone to Washington at a time of great political turbulence, hasn't he? Because Mr. Biden has said he will drop out of the presidential race. So Kamala Harris is probably going to replace him as a candidate. So Mr. Netanyahu is meeting with Mr. Biden as well as Kamala Harris. And he's also apparently asked for a meeting with the former President Trump. So trying to figure out what the political landscape in Washington is like. But he is under great pressure to agree to a ceasefire deal in order to bring a pause in the fighting and also to release Israeli hostages. That pressure comes from the Biden administration for sure, from elements in the Democratic Party as well, and from the families of the hostages. He met them in Washington, but before he left, they were protesting regularly, telling him, you've got to sign this deal. Don't go to Washington before you do. So that pressure has accompanied him to Washington, but it started here in Israel.
Barbara Plett-Usher. Well, as you've been hearing, the World Health Organization is warning that it is extremely worried about a possible polio outbreak in Gaza. Its regional head says many people are living in shelters with just one toilet for 600 people and little access to safe drinking water. Let's speak now to Samir Sah, who is Director of Programmes at Medical Aid for Palestinians. Samir, thank you very much for joining us on BBC News. You obviously must share those concerns expressed by the World Health Organization. Traces of polio have been found in the sewers in Gaza. But the last case was in 1984, I believe. How likely is it that you were going to see an outbreak, do you think?
Thank you for inviting me. As you rightly stated, last case was 1984, and it was 23rd of June. They took 7 samples from a sewage site in Gaza, and they found that 6 of them were actually positive for what you call vaccine-derived poliovirus. Now, this vaccine-derived poliovirus comes from a strain which is from the weakened live virus, which is given in oral polio drops. It is of massive concern because this is a population that is under continuous bombardment, have been displaced multiple times, and there are children who haven't been vaccinated for polio. So if this strain gets into children who haven't been vaccinated or who have a weakened immune system, they will get polio, which leads to paralysis of the limbs.
How contagious is polio?
It's very contagious. It's basically a fecal oral transmission route, so which means that it's from the waste in the sewage and in the gutters outside. And at the moment, because there is no waste disposal happening, it's very likely that it's going to spread.
Given that medical facilities in Gaza are overwhelmed, as we've heard, what approach are you going to try to be working on to deal with the situation if people have not had, and young children especially, haven't had vaccinations or have only perhaps gotten partway through the course of vaccinations?
I mean, the only thing that we can do at the moment is make sure that children receive vaccination. But actually, the solution is not just vaccination. The solution is that there should be a ceasefire now. The solution is that there should be an increase in the aid going into Gaza, especially access to clean drinking water and access to medical supplies and medical teams going in. To give you an idea, there were 11,000 trucks going in every month before the crisis started. For the month of June, compared to 11,000, only 581 trucks went into Gaza. So actually not much aid is going. And then ceasefire is also important because the repair of the sewage system, the repair of the water supply system is important. You have to clean up tons of waste that is on the streets of Gaza. And you have to rebuild roads, you have to provide a transport system so people can get into medical facilities. In fact, the bombings have to stop so that people can access medical care.
And just finally, briefly, Samir, without a ceasefire currently, obviously, to what extent can your teams mitigate the outbreak of a disease like this?
It's extremely difficult. It's extremely difficult because if you know, there's zero electricity in Gaza at the moment. Vaccines need a cold chain, which means they need to be kept refrigerated. So even if you deliver a lot of vaccines, then there's a big challenge of keeping them refrigerated. In fact, even fuel is in short supply inside Gaza. And so, yeah, our response is quite challenging. It's very difficult to provide the vaccines, even with the teams. And even if you are providing the vaccines, you are not taking care of the live virus that is in the sewage system already. So you have to tackle that as well.
Samir Sah, thank you very much, Director of Programmes at Medical Aid for Palestinians.
Thank you.
And let's return now to the political situation in the Middle East. And China says 14 Palestinian factions have agreed to set up an interim national reconciliation government to govern Gaza after the war ends. It follows talks in Beijing between representatives from each group, including Hamas and Fatah, which is in charge of the occupied West Bank. The Chinese Foreign Minister Wang Yi, who attended the discussions, hailed what he called the Beijing Declaration. Let's talk about this some more now with the founder of China Dialogue Trust, Isabel Hilton. Isabel, thank you very much for joining us. Many previous efforts to try to deal with antagonism between Hamas and Fatah and various other groups have failed. How much weight do you put behind this effort and this declaration?
Well, it's quite a big declaration. It's significant in that China doesn't usually, take risks like this. So China does have quite a lot of heft. As you say, a lot of previous attempts have failed, including attempts brokered by Egypt and many other intermediaries. And we have nearly 20 years of hostility now between these two factions. But we are in an extreme situation. We've got the continuing war and the devastation of Gaza, conflict on the West Bank. And the United States, which is mired in its own electoral politics and therefore can be, has limited effect. And the frustration that President Biden has been unable, apparently, to restrain Benjamin Netanyahu, which is, causing waves in the region. So for China, this is a big opportunity, and it's one that they have steadily been taking advantage of. The talks began very early in the year in Moscow and then moved to Beijing in April. In May, China hosted a big Arab conference as part of its now continuing diplomacy with the Arab world, in which China posited the need for an international peace conference. And now this. So there's been a lot of setting up of context here.
So why is China positioning itself like this, trying to broker some kind of deal? And to what extent do you think those involved in the talks in Washington, Joe Biden, Kamala Harris, Benjamin Netanyahu, to what extent do you think they will be paying attention to what's been happening in Beijing?
Well, I think they will be paying attention. There is a fundamental difference in approach in that the United States insists that Hamas must recognize the right of Israel to exist, and there has been nothing in any Chinese statement to that effect. So we have, essentially a very different approach. But the fact that China's weight in the region has been growing so much, it has good relations with Iran, it has good relations with Saudi Arabia. It's one of the biggest customers for Middle East energy. It's a supplier of renewable energy. So altogether, China's position in the Gulf and in what it calls West Asia is actually getting very strong. And the United States is beginning to look as though it can't quite, manipulate things as it used to. It can't quite bring a result as it used to. So for China, this is a big win in terms of its global image.
Just very briefly, Isabel, because we're almost out of time. Interesting also that Ukraine's foreign minister, Dmytro Kuleba, is in China at the invite or at the behest of the Chinese. They sent the invitation. What might be happening there?
Well, there has been, it's interesting because there's been very little contact between China and Ukraine. And I think China's trying to correct the global impression of facilitating and supporting Russia in its aggressive war against Ukraine. I think that is doing diplomatic damage. China, again, is trying to present itself as a peacemaker. It produced a 12-point plan last year with no diplomatic underpinning, but it continues to maintain a posture, if you like, of wanting peace.
Okay, Isabel Hilton, founder of China Dialogue Trust. Thank you very much.
Thank you.